This is Gene Krebs.
Hi there. Oh. Whoop. Whoosh.
And we're high on Ohio.
I think we do just tremendous work on education, advocacy, and supporting people with these terrible illnesses. But I've also seen the transformation of the mental health system. 88, we said we're going to close our hospitals and start serving people in the community. The problem is the money never followed the client. So we just let people out of the state hospital to wander the countryside. We don't need to put all these people in these hospitals that cost $600-700 a day.
Okay.
So we can treat them in the community. I just don't think it was a priority back then, and legislatures were looking at ways of cutting budget, and they just kept cutting and cutting and cutting and cutting. And we were always on the top of that list. I will say the last few years, I've never seen a bigger transformation in the support that we're getting. But unfortunately, it's because of all the bad situations that happened all over this country that people have said is a direct relation to mental illness. And the fact is, it's a direct relation to mental illness and untreated mental illness. I think people have recognized the need. There's been more money given to us by the legislature.
Okay.
We restructured our Medicaid funding system, so now it is looking at the whole person and not just the mental illness. Our people die 25 years younger than most.
Okay.
But it's not from mental illness. It's from all of the smoking.
Self-medication.
Self-medication. All the living on the streets.
Yeah.
Some. But the point is, we now have seen a change. I've seen the governor get behind this. He just gave the State of the State. 3 times he mentioned mental illness.
Right.
I have sat in so many State of the States, never,
Right.
ever heard the word mental illness.
Right.
Because you can't ask someone to provide care at a minimum level, or you're going to get minimum level care, and the people we represent are abused. So we're getting funding to increase that. We're also looking at some real alternatives of treating the person where they are, instead of going to a building and getting their counseling and getting their medication and leaving. We now have teams going out and meeting the person where they live, make sure that they're okay, giving them that support system. We have clubhouses starting to develop where some people who can't work yet, but don't want to be sitting and looking at TV smoking cigarettes, they can go and be in a social environment and get to know other people and learn in those. They run their own clubhouses and they learn how to cook. They learn all of the social skills needed to live out here in the community. And we're seeing tremendous, tremendous research saying this works. The other big issue is kids, younger kids. Since the Mental Health Act and closing hospitals, we've closed all state hospitals for kids. There are no state hospitals for kids. And the growing number of kids with diagnosable mental illness, 1 in 5, diagnosis of mental illness, only 20% are even seen by anybody. If we're going to be judged as how we treat the most vulnerable and people who need, I think we have to just look at that first. And if you have a mental illness that's an illness, it's not a character flaw, these are illnesses. If they're not treated, they will impact society forever in their lives. If it's revolving from one place to one place, the cost is horrendous. It right now costs $1,600 to be in a private psychiatric hospital. It costs $1,600 a day.
A day.
And it costs $700 in a state hospital.
Okay.
It's ridiculous. I get calls. I got one over the weekend sent here in Columbus, sent to a psychiatric facility, and there were 14 people in the waiting room waiting for a psych bed. 14 people in the one hospital. And obviously the 15th that came in wasn't going to get sent there. So we had to find another facility. And in most cases, we don't find a facility. They go back and live with they go back to family, even though the family is ill-equipped to deal with some of the symptoms that are exhibited. I definitely believe we need more community beds for longer term. That don't need all the supervision and the cost that go with that. But we also need a community support system where every individual with these illnesses has someone there to assist them when they're in need. Because that's where it breaks down. When nobody sees them for a week, and all at once they deteriorate, and then they go out and go to somewhere and do something, and next thing you know, the criminal justice system's involved, which is so inappropriate. People with these illnesses aren't violent. You talk about myths in our society. One of the greatest is if you have a mental illness that you're a violent person. The fact is, people with these illnesses are 6 times more likely to be victims of crime than commit a crime. Now, the horrendous ones that we see all the time, and the newspapers and the media pick up on, absolutely, that's an issue.
Right.
And let's address that issue. But let's address it, you know, a lot has come up about guns, and it makes me sick when we see that guns and mental illness are even discussed together. Because most people with mental illness don't have guns.
Okay.
They're never going to use a gun. They're never going to hurt anybody. They're going to be out in society, and if we become public citizens like the rest of us, tax paying, go get jobs, 80% of the people with these illnesses can recover. They do recover, not can. They do if they're given the appropriate treatment. And then they're among us right now. You wouldn't even know. And everybody that's listening, if you know a veteran whose behavior is just not quite what it was, get them help. And I've heard a lot of things in Washington about the veterans.
Okay.
But I haven't really seen the thrust that I want to see. We call ourselves the voice of mental illness because we feel we're the conscience. We're the ones living with the illness.
Okay.
We're the ones every day our lives are affected. So we try to advocate what is the best for our loved ones. Second is we educate.
Okay.
And I really think that's as much important as anything, is educate every citizen, whether they have a mental illness or they have a loved one. We will educate you on every aspect of the illness so you can recognize, understand it, understand what treatment's about. And then the last one, which is as important, the one that keeps me up at night, is the support I give and we give. We get 100 calls here a day where people who just are begging for help, and we can tie them in all over the state to the appropriate treatment facility, or at least give them a voice to talk to instead of a machine. I think it's time now for us to evaluate what we're doing with the money we have and show everybody that we are probably funded at a 50% level at best.
Okay.
We're so grossly underfunded. And that's from history. That's history. We lost $140 million over 7 years during in the first part of this 2000s. We have to get that back and get the funding necessary to provide housing, community support, case management, and continue the great work that the people are doing now. 70% of the severely mentally disabled live in our big communities.
Why is that?
Well, I think because they gravitate from smaller communities that have little or nothing.
That's true.
And to get care here originally, and then they just stay.
That's true.
Because if there is care.
For more about the Center for Community Solutions or their publications, please visit www.communitysolutions.com.